Hello everyone, I'm Siuli Mitra from Cohort A of 2024 India Leadership Journey. Over the next few minutes, I'll be talking about my leadership project, Her Health, Her Voice. During the course of this fellowship, I was a consultant at Department of Biotechnology Wellcome Trust India Alliance, where my role was focused on bridging research, science funding, and policy development efforts of the organization. Through my experience at India Alliance and in public communication of science and technology in India, I have seen firsthand how effective communication can be in shaping policies and driving public awareness to impact health outcomes. However, I also observed a significant gap which inspires my project. Women in public health experience both barriers and enablers while making their voices heard, whether it is in decision making spaces, research based discussions, or driving community health initiatives. The premise of my project is thus design communication training for women based on these experiences. The way practitioners communicate health information in general has direct consequences on awareness, behavior, and outcomes. While it is fundamental to effective healthcare delivery, communication is less talked about when it comes to building capacity. And when training is indeed available, disconnect with training needs makes it inadequate. As a consequence, practitioners across levels find themselves responsible for communicating health messages without any formal training in how to do so effectively. Rampant spread of misinformation as a result of unclear or inconsistent health messaging is something all of us are familiar with. These are further amplified by the socio-cultural contexts in which communication takes place, contexts that are often gendered. Women play a crucial role in healthcare, both as professionals and as caregivers within families, yet they face unique barriers when it comes to communicating health information. Their voices in health decision making are often undervalued, and gendered perceptions shape who is perceived, whether they are perceived as credible sources of information or not. If we want to make communication impactful, we must acknowledge and address these biases with a gendered lens. This approach could ensure that messages reach the right audience, are clear and relevant. Adapting training programs as new evidence as we go will also be critical. I began my work by examining how these issues are positioned within the wider context of communication training in science, technology, engineering, and medicine in India, following up with a pilot survey and few interviews with public health practitioners, both trainers and prospective trainees. These engagements helped me gather perspectives on current training needs, gaps in access to resources, among others. I'll zoom out a little bit and talk about how this is positioned within communication training in India. Training in this space is largely unstructured. It lacks formal recognition at par with research training. This gap affects how scientific knowledge reaches society. One of the priorities of practitioners in this space has thus been to build institutional capacity. Science, policy, and public discourse must connect, and effective communication training will ensure that knowledge moves seamlessly between these spaces. I'll share some insights from the pilot. 85% of the women who responded said that they had no formal training in communication. An assessment of current training needs showed that while more women wanted to be trained in digital tools and technologies usage, media engagement, and framing of message, training hasn't been adequate to meet these needs. A respondent shared that current training efforts are fragmented. She talked about the lack of a systematic approach and shared that training programs are very sparse and themselves silos. When I asked them about gaps in access to resources, they shared that access to digital tools and technologies is limited due to high costs. However, success models do exist and can be scaled up. Barriers to communication training were institutional, cultural, technological, and financial, while clear communication guidelines, strong institutional infrastructure, mentorship, and policy exposure enhance communication skills. A look at current training programs revealed gaps in systematic training, cultural contextualization, and policy orientation of the content used. The interviewees also shared that peer learning, media engagement for training, and community feedback were helpful for them. Over the next 1 year, the need assessment survey will be sent to more women in public health in India and across other global cohorts of WomenLift Health to gain a more comprehensive understanding of challenges. A critical next step for me is to co-create training guidelines, and for this, I'll work closely with stakeholders in both media and public health in India to design solutions that are practical and effective. My leadership journey has reinforced the importance of clarity, collaboration, strategy, and impact. Throughout this journey, I gained clarity on my vision, my own vision of the project, strengthened collaboration, and developed a strategic mindset for real impact. Mentoring, coaching, and peer support have been invaluable in shaping my leadership approach. I had more confidence in leveraging my own strengths in planning, execution, and relationship building. My mentor's advice led me to expand the study group, making the project more collaborative. I thank my mentors, coach, and cohort for their valuable support. Thank you.